Sophie Keen is the president of the Australian Medical Students Association, and she joins us now from Sydney. Sophie, g'day. So what do you think about the prospect of getting involved in the vaccination rollout?
I think most medical students are quite eager to support the rollout, as long as there is adequate training and supervision. Medical students have already been recruited in areas of Victoria, and we've long been trained to administer both flu vaccines and other injections in hospitals and general practices.
And so to what extent have medical students already been involved? You mentioned Victoria there. How many students and what were they doing?
We're not quite sure how many students, but they've been recruited as vaccine providers in some of the larger vaccine centres. And I believe we're also looking at medical students getting involved in Queensland as well.
Yeah. And so, Sophie, what's the potential for medical students to be involved? How many medical students could be incorporated in this program later this year? Are there thousands of you out there or only hundreds?
Well, we have 17,000 medical students in Australia, so quite a lot. And I would presume the older medical students, our clinical years, would be the group to tap into first. So there would definitely be a few thousand that are probably willing to strap up and get started.
And you mentioned it'd be really important to get the appropriate training, but it'd be pretty straightforward, wouldn't it? It's not as if you'd need to do another subject in your degree to learn how to do it.
No, I believe in Victoria they had a set of modules as well as supervisors on the ground supporting the students.
Yeah. And are many medical students already vaccinated?
Most are either fully vaccinated or about to get their second jab. We've been vaccinated alongside the other healthcare workers on our clinical teams, which has been really fantastic this year.
Yeah. And what's the sentiment generally among medical students about this? Because it's become a bit of a national effort, isn't it? Kind of a bit of a community effort to get this done. What's the feeling about rolling up your sleeves and getting involved in this yourself?
I think most medical students, like most Australians, are very eager to see COVID tackled really productively and comprehensively this year. And if we can contribute to that effort, we're quite eager to.
Yeah. And what are you hearing among young people? I'm kind of chatting to you as a young person now, generally not necessarily as a med student. But yeah, what's what are you hearing among young people about getting vaccinated? Are they keen? How do they feel about AstraZeneca? Because it's only AstraZeneca at the moment until later in the year when it becomes the mRNA vaccines.
There's definitely a lot of vaccine hesitancy in both the Australian public and young people. And I think a large part of that has been a lot of mixed messaging and probably a bit of complacency as well. I suspect that we'll see a lot more uptake now that the Delta variant has kind of reminded us of how susceptible we are to COVID in Australia. And hopefully moving forward, there is more of a community approach to getting vaccinated and doing it as quickly as possible.
Yeah, and as a budding medical professional yourself, how have you felt as you've watched what's happened in Australia with the rollout, the messaging, and some hesitancy?
Yeah, it's really tricky. I think that it's very much uncharted territories, and everyone is working to the best of their capacity, and we do need to be quite nimble as we respond to the latest evidence that emerges. But at the same time, there has been a lot of mixed messaging, which makes it really confusing for doctors and medical students, so let alone the general member of the public who isn't trained in healthcare.
Yeah, and so as a young Australian and someone who has noticed that there's a fair bit of hesitancy out there, as we get into this period where the supply is going to increase substantially over the next few months, how important do you think it is that there is some more effective national advertising campaign so we get over that hesitancy?
Yeah, I think national advertising, education, as well as greater support for GPs to communicate the vaccine changes will be really important moving forward.
What do you mean by greater support for GPs?
I think that GPs have really been the backbone of the vaccine rollout, but they've also been subject to so many changes as the vaccine regulations change. And I know a lot of GPs are very burnt out and very exhausted. And moving forward, we're going to be even more reliant on our general practitioners to complete the rollout. So I think there needs to be kind of a lot of national support for our GPs as we move into this even busier time.
And so what do you mean by support there? What do you mean in layman's terms? What do you mean by practical support for GPs?
So just anecdotally, I know a few GPs who would be conducting their vaccine clinics during the day, and then the guidelines surrounding the vaccines would change in the middle of the day or the night before without any communication from government to the GPs. And the GPs are only finding out through like ABC News or Twitter or their patients who come in and say, hi, I don't think I can actually receive this vaccine anymore. So there needs to be a national effort to be like working quite closely with our GPs and having some sort of communication system between like government and the regulatory bodies and the people on the ground.
Yeah, so improve those communication channels. Okay, Sophie, really good to have a chat to you, and it'll be really cool to see our young medical students get involved in this later this year, and let's hope those vaccination rates really improve. Sophie Keen, thanks so much for having a chat.
Thank you, Joe.